Okay, why don't we get started? Welcome everyone to tonight's webinar hosted by RMA of New York, Long Island. My name is Agnes. I am on the marketing team of RMA Long Island. And tonight we have a really special presentation. We typically do a monthly series of webinars that discuss egg freezing or basics of fertility, like a Fertility 101. But tonight we are hosting an egg freezing 101 that we're tying with kind of an inside look into the RMA of New York, Long Island laboratory. And we're lucky to have joining us tonight, Dr. Andrea Victor. Dr. Victor is the Associate Laboratory Director of the IVF Laboratory at RMA of New York, Long Island, and the Technical Director of the Molecular Genetics Laboratory at the, I hope I'm pronouncing this right, Zuvez Fertility Center in San Francisco. And she has a master's degree in applied mathematics and mathematical biology from Hunter College and a PhD in reproductive genetics and embryology from the University of Kent. So she will be on to answer all your questions about our embryology teams, the lab itself, and all of the work that goes into making sure that our specimens are safe and successful. And then leading our egg freezing 101 tonight will be Dr. Cary Dicken. Dr. Dicken, I can't believe you've been with RMA of New York, Long Island now for about 5 years.
5 years, yeah. I
Yeah,
know.
that's crazy. But prior to joining us and becoming an attending physician at RMA of New York, Long Island, Dr. Dicken was the Associate Medical Director for over 6 years at the Schur Institute for Reproductive Medicine in New York City. We should mention that she is board certified in both OBGYN and reproductive endocrinology and fertility. And she's been recognized by her peers and patients as an outstanding and compassionate physician, which I'm sure you will experience tonight as she gives her presentation. And so I'll let Dr. Dicken kick tonight's webinar off. I'd also just like to encourage everyone to put any questions that they may have into the Q&A, not the chat. Please use the Q&A. And then those questions will be answered at the end of the presentation. Thank you all again for coming, and I hope you enjoy.
All right. Well, thank you, and thank you, Agnes, for that. It's always nice to have that kind of intro, and thank you for everybody who is joining us this evening. I'm hoping this will be an interesting talk on egg freezing and kind of why to do it and how it works and what actually happens behind the scenes in the lab that Dr. Victor will certainly speak towards. So I'm going to start my talk by going through egg freezing and really why women should consider doing this. Okay, so by far the most common reason why women think about fertility preservation is because they want to postpone when they're having children. And I think what's really interesting and what a lot of women don't know is that, I'm just going to bring this chart here, is that the optimal age for women to conceive and to have healthy pregnancies is actually much younger than what necessarily goes along with our lifestyle and our career goals and our education and things that we are planning for now. So you can see on the chart, I hope you guys can see that, that really the time when women are the most fertile is basically in their teens, 20s, maybe early 30s. And while many of us may want to have children then, there's a large percentage of women that, for a variety of reasons, are postponing when they want to have children. And so that's probably the most common reason why I see women coming into my office thinking about preserving their fertility. There are other reasons why women may choose to delay childbearing. Sometimes it's financial. You're just not ready to be able to afford a family, or maybe you haven't found the right partner. I also think, and this picture is probably going to speak towards this. A lot of people have a lot of misconceptions about getting pregnant, and maybe think that fertility treatment and IVF and everything that thankfully we are able to do to help women and couples will always work no matter what the age, because sometimes in media we see stories and images of celebrities getting pregnant at these older ages, and we think that it's not going to be a problem, and unfortunately that is just not biologically correct. So there are a lot of reasons to think about preserving young eggs, mostly because as we get older, it does get more difficult to get pregnant. I should mention that there really are two options for fertility preservation. There's egg freezing or oocyte cryopreservation, and then there's also IVF to create embryos where you can freeze those embryos. And so when you're deciding between the two options, and for tonight we're really just going to talk about egg freezing, really the reason why you would choose one over the other is kind of your circumstances. If you know who you want to have children with and you're just not ready to have kids yet, it would be smarter to create the embryos and keep them frozen for the future. But if you want the option to decide in the future who's going to father your children, then you want to freeze your eggs. Okay, so I said before that women are, preserving their fertility because they want to delay when they're getting pregnant. And so I think it's really important to touch upon how age is impacting the eggs, right? So as little girls, we are born with our eggs, and we don't make eggs in our lifetime. We don't make more eggs the way that men are able to make sperm. And no matter what we do, even if we are preventing ovulation with a birth control pill or whatnot, we are constantly losing eggs. There is no way to stop egg loss. So as women get older and over time, women will have fewer eggs, but what's maybe even more important is that the percentage of good quality eggs, healthy eggs that can result in healthy pregnancies, is going to decline with age as well. So it's like this double whammy that hits women. We have fewer eggs and we have a lower percentage of genetically normal or healthy eggs, and that's going to make it difficult to get pregnant. So if you look at the bar graph on the left, you're going to see that the likelihood of getting pregnant starts to decline maybe a little bit in your late 20s, but it really drops after 32 and then most rapidly after 37. And that corresponds with when we see some of the more rapid changes in egg quality. And then the graph on the right is showing the rate of live births compared to miscarriage and aneuploidy. Aneuploidy meaning an incorrect number of chromosomes, usually coming from a poor quality egg. So our difficulty with getting pregnant as we get older typically is coming from poor egg quality, makes it difficult to get pregnant, and makes it more likely for us to miscarry. I wish there was a way to treat egg quality. Unfortunately, there's not. There are vitamins and supplements and alternative, medical treatments and things that a lot of women will use to try to improve their egg quality. But at the end of the day, we can't reverse the biological impact of age on these eggs. And so when it really comes down to a couple who's struggling to conceive because of poor egg quality and therefore not creating good quality embryos, the best option is to use eggs from a younger woman. And now that, egg freezing is so prevalent and our technology is so advanced to be able to do this successfully, when women are young in their 20s and early 30s, they can actually freeze their eggs and basically donate it to their older selves. And so that's the way I like to think about egg freezing for women who are coming in to speak to me. It's basically like your younger self donating eggs to your future self. So these are a lot of the most common questions I get about egg freezing. I'm going to try to touch upon most of these, maybe not all at once. Let me start off with, why you should freeze your eggs. Basically, as a fertility doctor, when I do testing, there is no test that tells me whether it's going to be easy or difficult for a woman to get pregnant. We really don't know that until a woman tries to get pregnant. But if we have younger eggs to work with, we are going to have more options in the future to be able to help someone who is struggling to conceive. And when you're thinking about egg freezing, you have to think about, well, at what point does it make sense? At what point should I put myself through a treatment and spend the money to do a treatment for eggs that I may or may not need, right? Because we don't know if everybody would need the eggs that they're going to freeze, versus having, eggs frozen and then, or having eggs frozen and then not needing them versus not doing it and then needing it in the future, right? So basically, we can't guarantee that anybody would need their eggs. We can't guarantee that somebody will get pregnant from their eggs, but having them is ultimately going to give us more options to help somebody to conceive. And according to ASRM, egg freezing is not a treatment to be done to address an immediate fertility problem. It's something that should be done with the goal of preventing future infertility. So some people think of it almost as an insurance policy, but really what it is something that will give you more options in the future. So who should freeze eggs? Really, anybody who knows they're going to be delaying childbearing should consider freezing their eggs at a younger age. And then clinically, there are certain scenarios where we need to freeze eggs. Somebody who is perhaps being diagnosed with medical condition that's going to compromise their fertility, that's somebody who should freeze their eggs. And then rarely, and this kind of goes beyond the scope of tonight's talk, but for ethical reasons, some couples are not comfortable with the idea of freezing embryos, and sometimes we will freeze eggs for that reason rather than fertilizing all of them. In terms of timing, when should I freeze my eggs? When is the optimal age to do this? There really isn't good data to be able to say exactly when, at what age women should do this, but really the best advice I can give is younger is better. But again, it's a balance, right? So the younger a woman is when she freezes her egg, the more likely those eggs are going to be good quality and create embryos that will result in pregnancy in the future. But when you're young, there's probably less chance that you're going to need those eggs, because at a point when you're ready to think about starting a family, it still may be very likely that you just get pregnant on your own, versus waiting until you're older when it is going to be more difficult to get eggs, and those eggs are not going to be as good, and now you really need them, and they may or may not serve the purpose that you want in the future. So there's no specific age where you must, like a hard stop on when you must freeze your eggs, but you want to think about your age, you want to think about your egg quantity, and I'll talk to you about how we determine that. You want to think about your stage of life and how soon do you think you're going to want to have a baby. And then you want to also think about your ultimate family plan. Final slide I just want to touch upon, and then I'm going to turn this over to Dr. Victor. I want to talk a little bit about how an egg freezing cycle will work. So the first thing I do after speaking with a patient who is considering freezing her eggs is I want to get a sense of her ovarian reserve. So remember I said that women as little girls were born with our eggs. We lose them over time, and there's nothing we can do to stop that loss. With sonogram and with blood work for a specific hormone called AMH, or anti-Müllerian hormone, I can get a really good idea of a woman's egg quantity, and not a specific number, but just how it compares to other women of the same age. Am I concerned that the egg quantity is low for a woman's age and perhaps the ovaries are aging a little faster? That's going to be important for a variety of reasons. It's going to help me guide the patient as to, whether or not we should really be doing this, and maybe we need to do this for multiple cycles to get enough eggs. It's going to help me come up with a protocol and medication. And so this is where we're going to start. When we do an egg freezing cycle, the medications that we use are the same medications that a woman would use who's going through IVF. These are injectable fertility medications that are stimulating the ovaries to grow eggs. So I cannot give someone medication and make eggs appear. Unfortunately, I can only help the eggs that are there to grow. And so most women are going to use 2 to 3 shots every day. I would say on average, somewhere between 10 to 12 days, frequent monitoring early in the morning during that time, followed by a procedure called an egg retrieval that we do in our office to extract the eggs that have grown from the ovaries. So the whole process from the start of those injections until we actually extract the eggs is approximately 2 weeks. So this is not a very long process. The egg retrieval is a procedure. It is not a surgery. There's no incisions, no scars. It does require IV anesthesia. Otherwise, it would just be very uncomfortable for women. But the sedation, most women are sedated for maybe 15, 20 minutes. It's pretty quick. And then once we have those eggs in the laboratory, we're going to assess them to see which ones would be ready to fertilize. But instead of fertilizing them, we're going to freeze them. So that's sort of where I'm going to pause right now, and Dr. Victor can talk to you about the specifics of what's going to happen in the laboratory, so that you have an idea of what we do once those eggs are extracted. I'm sorry, I'm just going to stop sharing my screen here so that we can switch.
Great. Thank you. Thank you, Dr. Dicken. All right. That, Dr. Dicken, you can see that, right? Oh. Yeah, okay, great, thanks. Okay, this is where the lab comes in. So yeah, I'm going to talk to you guys a little bit about the process of what happened. So Dr. Dicken kind of summarized, how we get to this point after stimulation. So this is where, the lab takes kind of ownership. So Dr. Dicken would be passing over the follicular fluid that she aspirates in the operating room and handing to the lab, where we will start searching for the oocytes and start preparing for vitrification. So I'm going to literally go through this like a timeline, just so that everybody has a little bit of information, just so you know what's happening in the background here. So the tubes get handed off. They get put into a warm block, and they get passed into the lab actually through a window that exists between the operating room and the lab itself. And then we start, under a microscope in like a very controlled and heated environment, we search for something called cumulus complexes, which are basically helper cells that your egg travels with. So it's like a protective cluster of cells. And that's what we're looking for in the lab. So under the microscope, we're trying to spot these cluster of cells. We gently isolate these clusters, and then we move them into a culture dish that then rests in an incubated environment for a couple hours. Then once the eggs have kind of been, resting for a little while, we are able to kind of take them through another process, which is where we remove these, helper cells, these cumulus cells, and it allows us to take a closer look at these oocytes and really kind of evaluate them for maturity and for quality. So we're trying to make sure at this time that the egg is in the right point in its natural timeline and ready for freeze. So the mature stage that we're looking for is called a metaphase 2 oocytes. So it means that these oocytes have completed the first step of division and are really the very best candidates for freezing. They're in just the perfect state. And so, yeah, so we're looking for maturity and overall health under the microscope. So that also includes things like their shape, appearance, how the outer shell might look. And from there, we select the eggs that meet our criteria and we move them straight into the vitrification process. And again, that whole review is kind of choreographed so that eggs are spent a minimal time out of the incubator and that we're really able to hit the optimal window for egg freezing. So next, a little bit of time. So we prep for the freeze, which again is also like a very sensitive timed step. So we prep our media that's required to make this happen, and also the devices that they're frozen on. So this is what a freezing device looks like. And essentially these oocytes are going to be put through a series of medias and deposited on a device like this and then plunged into liquid nitrogen. So we actually aren't freezing them, but we're vitrifying them. And so that means that we're actually, turning them to glass. So eggs are like a very water-rich cell. And if you're not careful during the freezing process, ice crystals can form and it can damage the inner machinery of the cell and the membranes. So we use something called vitrification. So basically like a rapid glass state, which avoids the formation of these crystals. So once the oocytes are safely on those devices and plunge into liquid nitrogen, they go onto a cane, and then that cane is given a specific address within our cryo inventory. So it's given like a tank, a quad, a canister, all these things that follow it. So we know that that's the place where your gametes will be stored. And so, yeah, I just wanted to talk for a second about why the little things matter when it comes to the labs. So eggs are single cells, so they don't have an immune system, they don't have a body to buffer them. So the lab kind of really becomes their protection. So we focus on a lot of little details. We focus on the quality of the air in the lab, the quality of our supplies. We make sure that we have HEPA filtered, low VOC air. We make sure that we, perform appropriate quality controls on every single thing that, your oocyte might come in contact with, our dishes or our media. We make sure that the pH and the osmolality is just perfect for those oocytes. And then there's the environment. So our incubators hold a steady kind of body-like temperature, and then they maintain the appropriate CO2 and O2 concentrations. And we have special incubators that recover quickly if the door is open, to put the dish inside or to take it out. Also, our workstations where we're performing these procedures are warm, and so our microscope stages and CO2 hoods keep the eggs at the correct temperature and pH while we handle them. And then also, as I kind of mentioned before, the timing also matters. So again, kind of choreograph the workflow so that the eggs really spend the least amount of time outside of the incubator, and we freeze at the best biological moment. And finally, people and process. So a seasoned embryology team, appropriate witnessing step, checklist at every handoff. In my opinion, these little things really add up to higher survival and better outcomes when you do come back to use your eggs. Okay, so 2 buckets kind of help us explain why outcomes can vary. So on the left is biology, which Dr. Dicken really kind of already spoke to. So obviously, your egg supply and age. There's natural cell-to-cell variation and how your body responds to stimulation, and the lab really can't change those. But on the right, I kind of wrote things that are pertaining to the process. So that's where kind of great labs move the needle. So when you have these types of strict controls like strict air, media quality routines, disciplined timing, and a seasoned team that repeats these same steps every single time, you can kind of improve the process. So our job basically is to remove any avoidable risks so that biology can do its best. So that's why you'll kind of see the embryologists of the world obsessing over the boring stuff, checks, timers, logs, because those little things can really add up to better odds. So again, biology can kind of set the ceiling, but the process can really help decide how close we get to it. So once your eggs are frozen, they get put in, as I noted before, they get a specific address within one of our liquid nitrogen tanks, and these are watched constantly. So we have 24/7 monitoring of tank temperature, nitrogen levels, room conditions, and if anything drifts, our system sends instant alerts to on-call embryologists, and we respond right away. We have massive nitrogen supplies. Fortunately, we have lots of space here, so we're always able to keep lots of nitrogen on hand and spare tanks on site. So, should there be any type of issue, we can change tanks quickly. room has power backups, UPS devices, generators, and so storage stays stable, like even if there's some kind of an outage. And then access to the tank room is also controlled and logged. So really every touch point is documented. Yeah, so it's these layers of protection are there by design. So, one hiccup never becomes your problem. And Dr. Dicken, I think I'll pass it back to you for, do you want to go over next steps, egg freezing considerations, what happens kind of when a patient comes back?
Sorry, I was on mute. I do that constantly. Okay, so going back to kind of that list of frequently asked questions that I get, how long can eggs remain frozen? Simple answer is indefinitely, right? So long-term storage of frozen eggs does not seem to decrease the quality of the eggs. And so the way I explain it to my patients, it's really the time of the freeze and the time of the thaw that are the most critical points, but the duration of time in between that the eggs are frozen is probably less important. And there's certainly data out there that shows healthy egg fertilization from eggs that have been frozen for well over a decade. So when you're thinking about freezing your eggs, and if you're thinking, well, I'm young and I have good quality now, but I don't think I'm going to use them for a while, I don't think that should be a concern in making a decision. Next question I often get is, well, how many eggs do I need to freeze? And I think many of my patients are surprised to learn how inefficient our human reproduction is. And what I mean by that is that it takes a lot of eggs to get one successful, healthy embryo and pregnancy, right? Having one frozen egg does not mean one embryo and one future baby. We want to freeze many eggs to give women decent odds that those eggs will result in a successful pregnancy and live birth in the future. And age is going to play into this again, because like we said earlier, the quality of the eggs, the likelihood of an egg being chromosomally normal is going to depend on the age of the ovary that it's coming from. So for example, on the top, for a woman who's under 35, what I would typically expect is a very high percentage of the eggs should survive the freeze and thaw process. Again, everybody's an individual and it's not a specific number, but usually I would say the vast majority of eggs are going to survive, maybe 90 to 95%. We expect about 80% fertilization with the process called ICSI that we use to fertilize these eggs. And for women under 35, I would really hope about half of those initial embryos created, right? An embryo is just a fertilized egg, are going to develop to a stage where we can consider using them. And so typically, I would say for women under 35, having at least 10 eggs probably gives something close to a 70 to 80% chance of having one successful pregnancy. And so that's usually my threshold. For women under 35, I want to have a minimum of 10, preferably closer to 15 eggs frozen to feel pretty confident that we can have one successful pregnancy. But that's not going to be the case when women are older and choose to freeze their eggs, because we know there will be a lower percentage of good quality eggs, meaning fewer are likely to survive the thaw. Fewer of those are going to fertilize properly and develop into embryos. And so it's possible if I had 10 eggs for somebody who was 39 or 40, I may not even get a healthy embryo from that. So when women are older, we want them to have more frozen eggs to feel that same level of confidence that the eggs that are frozen are likely to be successful for them in the future. So there's no magic number, but that's kind of how I think about things. And then, at the end of the day, this is all about the age and the quality of the egg. So looking at this chart, you can see for women who are, let's say if we just look at the row with 10 frozen eggs, you can see that the likelihood of those eggs being successful are like 69% for women who are under 35. But if you go across to a woman who's 40, it's half of that, right? So it just speaks towards the likelihood of the eggs being healthy and creating healthy embryos in the future when somebody wants to use their eggs. This was an interesting article that was in the New York Times a couple years ago. It's actually talking about a study that was done at NYU. And what they found is that the age that a woman is when she freezes her eggs makes a significant difference in the likelihood of those eggs being successful for her in the future. And so seeing this and knowing that each individual egg is very unlikely to result in pregnancy is not meant to dissuade anybody from doing this type of treatment. It's still an excellent treatment for most women, but you have to understand the reality of what you're doing. It's not a guaranteed baby. It is a numbers game, and you need to have a good number of eggs frozen just to kind of give you decent odds of having a successful pregnancy in the future. And then finally, I get a lot of questions about the cost of egg freezing. Unfortunately, not all insurance plans are covering this type of treatment yet. And when it's out of pocket, it can be costly. And there are different costs involved that you may not think about when you start thinking about this treatment. So you have to think about the cost of medications that you need for the treatment cycle, the cost for all of the extraction and procedures in the lab to be able to get the eggs and freeze them properly, the cost of keeping them frozen and stored, the future cost if you want to use these eggs, right? So when you freeze your eggs, these eggs will require IVF in the future. And so there will be additional cost to be able to fertilize the eggs in the laboratory in the future. And then finally, there's the cost of taking an embryo and putting it in a woman's uterus, right? Preparing the uterus for a woman to get pregnant with an embryo that is created in the lab. So there's a lot that goes into the cost. And I will tell you at RMA, we have a financial team that really will do everything they can to help women to afford to be able to do this, because we do think it's important for women to be able to preserve their fertility. If and when we're able to get insurance to pay for all or some of the treatment, we absolutely do. And when that doesn't work out, our financial team is really great at working with our patients to kind of go through other options to make this a viable treatment for them. We don't want finances to prevent anybody from choosing to do a treatment that they really want to do. I'm not sure. I think, Dr. Victor, that's all I have. I don't know if you have anything else you wanted to share. I'm certainly happy to answer questions.
Yeah, I mean, I have a couple slides on just kind of what happens, after you freeze the eggs, if you come back to thaw. Do we have a minute? Should I share those? Is that helpful?
Yeah, that would be great.
Process? Okay. All right, so just to kind of review the lab side of things, Dr. Dicken just explained it really well, but what happens when you come back to use your eggs from like the lab perspective? So the step one is of course thawing, and we warm those cryo devices that we showed you before. You can see one right here. It needs to be warmed in just a matter of seconds. We rehydrate those eggs or oocytes over a few minutes. Again, that timing is really relevant and has to be very precise. Too fast or too slow can stress that cell. So that has to be done by, trained embryologists on a very set clock. And then right after we thaw, we let those eggs rest, and then we'll reevaluate them for survival. And again, like the survival, it's not just about how the egg was frozen, but of course it's also relevant how it's warmed and rehydrated. So you want, again, these consistent methods and experienced hands at the helm. Dr. Dicken just mentioned, so in order to fertilize those oocytes to make embryos, we would use a procedure called ICSI, which is where we take a single sperm and we deposit it inside the cytoplasm of, inside the membrane of the oocyte. It's very precise and it gives each egg kind of the best shot at fertilizing and hopefully, becoming an embryo. From there, we grow them, about a week, like 5 to 6 days, and then they reach the blastocyst stage. So hopefully we're looking at something like this. And there's, we can assess that for morphology. And at that point, you can either freeze them or transfer them or whatever the case may be. So yeah, again, the processes that we use for ICSI and these extended cultures and growing of embryos, those are kind of standard in our program, and they help us just reduce the variables so that your biology and not any lab noise affects the outcome. Just a couple common misconceptions. Dr. Dicken already did go through a few of these already, but eggs are guaranteed future babies when, we all wish it worked that way, but frozen eggs are chances, not promises. So the two biggest drivers are really the age at freezing and how many eggs you bank, as she just went through. Second, I can freeze anytime, and typically you can, but sooner is usually better. So egg quality and quantity decline with time. So earlier banking typically buys you better odds with fewer cycles. Third, freezing damages eggs. And certainly standard freezing could, but today vitrification is really widely used in our industry. It's ultra fast, and in good labs, survival after thaw is high, but technique and experience matter. Last, let's see, all clinics freeze the same. So, we could have the same tools, the exact same incubators, the exact same media, but it doesn't always equal the same outcomes. Again, those results really depend on process control and seasoned teams that do this type of work every day. So again, just big picture, our job is to stack the deck in your favor to make sure that we're freezing at the right time with the right numbers, highly controlled process so that your future options are as strong as possible. So it's, again, egg freezing, it's really about probabilities. That we do our best to improve. And let's see, so why labs differ. So again, even when we all use the same type of equipment, there can be variability and the differences in the process. So I know I mentioned these before. So clean air, stable temps, time discipline, calibrated incubators, media checks, chain of custody. So yeah, same tools don't always guarantee the same outcomes. So we're always trying to move the needle quietly forward in our lab. And just before we wrap up, I thought this just might be interesting for people. So a quick peek at kind of what the future of egg freezing holds. These aren't things that are in use now, and it will probably be a few years, but it's still something interesting as it pertains to egg freezing and IVF in the future. But there are people working on these kind of smart selection tools. So you have people trying to use AI, just like in any other field, trying to read egg images and look at videos of oocytes and embryos to extract patterns that our eyes can't see. So there might be signals there that might predict, which eggs are most likely to become strong embryos. And that could be helpful in deciding how many oocytes you need to freeze, right? Because there's variability from person to person, and there's certainly things there that we can't see, and it's hard for us to predict the future. But hopefully something like that comes through the pipeline at some point. And it's definitely exciting, but still experimental. Definitely needs solid validation. So today we rely on experienced embryologists. Then, of course, we're always looking towards gentler chemistries, better tools, softer cryoprotectants and freezing devices that are hopefully designed to reduce any osmotic stress and better protect those single cells that we're being so careful with. And then another thing that's kind of, exciting in our field is automation. So think kind of robotics that might help us standardize certain steps that are very exact, like exact exposure times and handling, so that every egg gets, identical care, while we still have the humans in the background making those judgment calls. So big picture, we're all always working towards safer and more consistent freezing methods, and better outcomes for our patients. But remember, eggs that yeah, I guess I'll leave it at that. So that's, I think we are open for questions, right?
All right, I'm just looking at the Q&A here. How long can eggs be kept for once frozen? So that really is a indefinite duration of time. I mean, it really depends on when you need to use your eggs. And so it's not so important to us how long the eggs are frozen. It's more important to us the age you are when you freeze the eggs and the quality of the eggs that we're going to get. That's what's going to give you your best shot for success using the eggs in the future. There's another question. If I'm 40, about to turn 41 soon, is it too late to freeze my eggs? So no, the simple answer is no. I certainly have patients in their early 40s who freeze their eggs. What I tell them, and I'm just very honest, I don't like to sugarcoat things, is that a very large percentage of those eggs are not going to be healthy. And so when we're freezing eggs as women get older, we want to think about doing more than one round of an egg treatment cycle, of an egg extraction, in hopes of really banking away a lot of eggs if we want to be confident that they could, result in a successful pregnancy. Do AMH levels change? If they are considered low, is there a chance that it will increase or continue to decrease? So AMH levels constantly decline. That is just what happens, and it's completely out of your control. AMH levels tend to decline faster as women get older, meaning if by chance, and I've seen this many times, a young woman, for whatever reason, has her AMH level checked and it's low, right? I had a 28-year-old who once had her AMH level checked and was scared because it was so low and came in to see me, and that level never changed for several years, and she actually had no trouble getting pregnant. So I think it's important to know with AMH, you don't want to really hung up on the number, because the number doesn't predict the quality of eggs. The number doesn't predict if you're going to get pregnant or not. It just helps us to know about egg quantity. But unfortunately, AMH levels do not go up over time. Now, there can be variations in labs. So some people will see their actual number go up, but that doesn't mean that they have more eggs than they used to have. What I would interpret that to mean is that it's probably stable. Occasionally I'll see a falsely low AMH level when somebody's on like a birth control pill or something, but it again, when it's higher, it doesn't mean that things are better. It was just kind of falsely low. I hope that answers that question. Does it make sense to freeze eggs for short term? I mean, I think that depends. If you're planning to freeze your eggs for, couple of months, probably not. The likelihood of getting pregnant is probably not going to be drastically different, after 3 months, let's say. I think it also depends on the age you are when you do this, because again, if we're freezing, let's say you're in your late 30s or early 40s and you're thinking about egg freezing, I know that you're going to have fewer eggs for me to work with, or for Dr. Victor and her team to work with, when you freeze and then go to thaw them, because they're not all going to survive. Whereas if we try to fertilize fresh eggs, we're going to have more to work with. At the end of the day, it's hard to know if that really gives us better outcomes. But I think if you're of an older age and you're thinking about egg freezing for a short period of time, it probably does not make a lot of sense. I think egg freezing makes the most sense when you know you're going to be delaying when you want to get pregnant, or, there's a medical reason you need to freeze your eggs. Sorry, one more question that I see. Have you seen any issues in lupus patients with egg freezing? That's a great question. Lupus is one of those autoimmune conditions that certainly when there's a single autoimmune condition, there can be others and it can affect egg quantity. Hard to know about quality. I can't say specifically that I've seen a medical issue or a problem that a patient has had when they're using medications to freeze their eggs who has lupus. But what I will say is often when there's an autoimmune condition that exists, it can affect the eggs and a woman's fertility, and so it may compromise the quality. We may think they're better quality than what they actually are. But lupus can be tricky because even in pregnancy, I think, what I was always taught is like women's symptoms with lupus, a third get better when they're pregnant, a third get worse. So everybody can be a little different. It's a little tricky with autoimmune conditions. But that being said, if you have a decent egg quantity and you're at an appropriate age and you're not ready to have kids, it's not a bad idea if you have an underlying autoimmune condition to freeze your eggs. What kind of medical conditions will insurance cover egg freezing, possibly other than cancer? I mean, cancer is really number one on the list. Occasionally, endometriosis. Sometimes we can make an argument because if there are surgical interventions for endometriosis and there's a risk of losing an ovary, sometimes we can use that as a way to try to say that it's medically indicated to be able to freeze the eggs ahead of time. So I would say cancer is number one, maybe endometriosis number two. And then really any kind of, radiation exposure, anything like that. I guess that would be related to cancer most likely. But, for whatever reason, there can be other conditions that sometimes get chemo and radiation. Any other questions? Anything I missed? I hope I'm catching everything.
You got them all.
My last 2 cents before we go is I think, in my opinion, there's no reason not to freeze your eggs. I think it's just really important to understand the reality of what it is to have frozen eggs, right? As I mentioned, Dr. Victor mentioned, a frozen egg does not mean a future baby, as much as we wish it would. It really is just more options in the future should you have trouble getting pregnant, right? We always know that younger eggs are just more likely to be successful than older eggs. And I think the invasiveness of this procedure, most of my patients are pleasantly surprised by how easy it is to freeze their eggs. Most feel pretty good during the cycle, if I'm doing my job correctly. Hopefully there are many eggs growing, and it's normal to get a little bloated, but it's very short-lived, and it's worth the outcome, in my opinion. Very little risk to future fertility, right? When we freeze eggs, we're not extracting eggs that you wouldn't have lost anyway. So a woman will not go into menopause earlier than expected because we extracted 20 eggs for an egg freezing cycle. There should be no negative impact on future fertility. So ultimately, and unfortunately, what it comes down to often is making a decision financially. I think if you have the financial means to do it, or if insurance is going to cover it, or you can just make it work, I think it's a really smart idea to give yourself options in the future. I guess if there aren't any other questions.
No, that was wonderful, Dr. Dicken and Dr. Victor. I feel like I learned a lot more about everything during this session. So I really appreciate all of your time and insight. That was very informative. I think, yes, since there's no more questions, we'll wrap up here. If anyone still has any questions or they're interested in making an appointment to see either Dr. Dicken or another one of our physicians at RMA of New York, Long Island, we have 1, 2, 3, 4, 5, 6, 7 physicians at RMA of New York, Long Island, and 6 office locations. Melville, which is where our laboratory is located: Garden City, Lake Success, East Patchogue, West Islip, and Stony Brook. So we really try to make ourselves accessible and convenient for you while you're getting treatment. And so feel free to either email us to make an appointment. You can email info@rmanyli.com, or you can give a call to 877-838-2229. And if you have any questions specifically for Dr. Victor or about the lab, you can also email those questions to that info@rmanyli.com address, and they'll get you connected to the right person to answer those questions.